Welcome back to the Beyond Electric Sheet podcast. I'm Brick Thompson.
And I'm Ed Daniels.
Ed, we thought for this episode we would talk about some of the things in terms of ethics and responsibility and costs around the fact that AIs are going to enable much better and cheaper and accurate diagnostics than currently happen in the world. Maybe you can kind of set us up with an example.
Yeah. Well, I was talking to my son recently. He's an orthopedic spine surgeon, and so that means every day, I don't know how many MRIs he orders, but he orders quite a few because that's necessary for diagnosis and also treatment planning. So, and I was sort of asking him, well, gosh, I've been reading about AI's advancements in image recognition, and I wonder if radiologists are worried about being put out of a job because the AIs are getting so smart at being able to detect various problems, disease states with X-rays and other more advanced imaging techniques like MRIs and CAT scans. What about that? And he said, as you might expect, as the spine surgeon, he's going to read every single MRI himself. Why would he depend on anybody else to do that? And so he's not going to count on an AI to give a diagnosis or anything. He can read that himself and come to his own conclusions. And I said, oh, okay, well, thanks, son. Nice talking to you. I'll talk to you about some other topics. And he said, well, wait a minute, Dad, there's one other point, and that is, even though I'm looking for an orthopedic problem, it could be that there's additional information that's buried in this scan that I'm not particularly looking for. So what happens if there's a lung nodule or something? You're imaging a spine, but there could be other things that aren't in the scope of what I'm looking for. So why not have AI overread these images? They're getting taken anyway, and see if you can parse out some other kind of disease state. So I thought, wow, that's great. Why would you not do that?
Yeah.
But, there may be some reasons to not do that. I mean, there's the added expense. But anyway, I thought that was an interesting thing, and I think there's a general case for that specific case that we could talk about.
Yeah, okay. That's really interesting that he's thinking about that. So let's assume the expense is negligible. Like you run it through the computer, it kicks out and says, hey, there's something interesting. I'm assuming it still wants a radiologist or someone who's trained in reading that to confirm what it sees. So now let's say, we'll stick with your example. Let's say you found something in the lung that needs investigation. Looks like it might be a cancer, for example. Right. So now you've got all sorts of interesting issues like, all right, who's now responsible? So your son was treating a spinal condition, and all of a sudden this new thing showed up, and that's the responsibility of a different department, right, oncology or something. You would really need to make sure that there's an airtight process for that handoff to happen.
Right.
Because if it didn't, then who's got the liability there?
Right. And that's a good question. It's one thing for the imaging AI, to identify a problem or a suspected problem. It's another thing to manage the workflow associated with that, the legal issues, making sure that if you refer it to like you said, an oncologist, that person looks at it, renders some type of opinion, follows up with the patient if appropriate, et cetera. So,
I guess
interesting.
It's funny, as I was saying it, though, I realized, we already have that. You go in for, I don't know what, you think you've got some nerve thing because your hand is buzzing or something, and they do their tests and realize, oh, shoot, it's MS. Yeah, so now you're going down that path. So there's already process in place for that stuff.
Right, yeah.
But then there's the question of maybe you're finding and exposing stuff that is too much. People don't need it. There's a psychological load. I've been reading about these, what do they call them, liquid cancer tests or something, where you just take blood and you can sample the blood for various cancers. And there's some question about whether that's a good thing because you're probably going to find cancer DNA. I mean, we're all producing cancers every day, and our immune systems are dealing with it. And do you want that psychological load of I might have cancer? I guess you do if you have a lung nodule, okay. But if you've got something else more minor, there may be sort of ethical questions about that.
Well, I think the whole issue, PSA testing for male prostate cancer, for example, it used to be the standard, and now you find certain medical organizations are saying, let's not do that anymore because it ends up finding false positives. Well, I would want to know about a false positive myself, but I think the population health issue with that is it generates way too much additional work. It costs a lot of money. That money could be spent for better purposes, and it makes people anxious, so better to just not do the test altogether, which I don't like that line of thinking.
Not just anxious, though, but you might do a biopsy that creates, there's some risk there
Absolutely.
that creates some other problem. And so are you just creating problems?
Right. Well, to me, you think about intelligence, artificial or otherwise, and thinking through the chain, having the data, what is, if you have a false positive, what's the likelihood of having a false positive? You can sort of use Bayesian statistics to kind of help you make some decisions about what you should do about that. You want to understand what the risks are of doing additional testing, what the costs are, what the penalty might be if you don't follow up on it. All those things take some pretty complicated thought processes, and whether it's a medical system, meaning a procedures, a medical process, or whether it's a doctor thinking about it, or whether it's you as a patient thinking through the process, there's some fairly complicated analytics or decision trees there in figuring out what to do. And now you layer on top of that the emotional reaction or the emotional penalty of thinking about what might be wrong with you. It makes for a pretty complicated situation.
It does. And then bring in the issue of payers, the insurance companies. You can imagine a case where if you had AIs looking at everything and we're discovering a lot more problems that needed to be dealt with, there's a cost of dealing with those. All of a sudden, the cost for health insurance could skyrocket. How do you figure out what you should be looking at or not? And
I was about to say, we should use the AI's reasoning capabilities to help us think through these things, whether it's us as individuals or physicians themselves or the healthcare system. But also think about this. What if, the AI detected this lung nodule? Now, do you really trust that AI to think through whether to follow up on it or not, whether to call it to your attention, or is that something, wait a minute, now we better have some transparency. We better spit this out and
you have to
think
right?
about it. Yeah.
No way you cannot tell the patient about it.
Right.
So then the patient has to deal with it. Insurance has to deal with it. I guess it's possible also that in terms of the payers, that discovering stuff early, when you can treat it less expensively rather than in some crisis later when it shows up, maybe actually that offsets. I don't know.
That's always the theory, right? You would hope that by dealing with it, being transparent about it, it's going to be the best approach, and ultimately the payer ends up better off financially. But then also there's this thing called churn in health insurance where patients might only be with a particular insurance company for a short period of time, and then they may get handed off to another insurance company, or they lose their insurance, they get a different job, different things happen, and so the insurance company, maybe if you're preventing the patient from getting a disease 5 years from now, that may not be that insurance company's responsibility anyway.
Right, so they don't get the benefit of having done that.
So if you're doing a strictly financial analysis,
the population shifting around, you should get the benefit from someone else having done it.
Yeah, hypothetically, yes.
Maybe.
Right.
Yeah, it's an interesting thing. I think we're going to be seeing this. I mean, we're already seeing the case where certain AI imaging tools are finding stuff that the radiologist is not finding.
Right.
I think they're at least using it for confirming in some cases and so on. And I'll bet you your son is a surgeon. There's going to be some of that too. It's going to come back with a reading. He's going to, of course, want to confirm that and order additional tests or whatever. But I bet it'll be in the loop. I don't know.
I think it's interesting, but just the idea of harvesting this huge data stream. In this case, we're talking about medical imaging, but there's all kinds of other data streams that you could apply an AI to monitoring to identify anomalies, problems, quality issues, fraud, different things like that. And so it's going to be, because it'll be so much easier to monitor data intelligently, that is going to be, there's going to be an awful lot of noise generated where there wasn't any noise before because we just didn't even know.
Yeah. As someone who always wants to deal with every problem, I sort of, I like a squawk-free life. If there's a problem with my car, I fix it.
Right.
If there's a problem with my house, I fix it. I feel the same way about my health.
Yeah.
It could be problematic to get that much input. It's going to be interesting.
I think it'll be interesting, but still, fascinating, and especially because these things can talk, so it can tell you what it's finding in language, a human language.
Yeah. Cool.
Yep.
All right. Interesting. Thanks, Ed.
Yep. Thank you, Brick.